Hello, good afternoon, and you're very welcome. This is today's Facebook Live, which we are talking about IVF, failed IVF, and fertility. I'm Terry Morris from Impulse Hub, and I am your host. And with me is Siobhan Kyo, who is the Clinical Director of the Fertility Treatment Clinic, and also Fiona Chauveau, who is one of Siobhan's patients, and she'll be talking about her fertility journey. So Fiona, you're very welcome. Thank you for coming today. Okay, so for those people who don't know, Siobhan is a registered midwife and a registered general nurse. She's worked in Ireland, England, and Australia, in a Dublin fertility clinic, in an antenatal clinic, and also in an early pregnancy unit. She's been helping couples with fertility for nearly 20 years. She's a qualified herbalist, a registered practitioner of traditional Chinese medicine, and holds a diploma in obstetrics and gynecology. She uses both Western and Eastern medicine and has been helping couples since 2001. So if you have questions, please put them in the comments and we'll do our best to get them answered. So today we're talking about IVF and failed IVF and fertility, and I'm going to start with Siobhan. So, Siobhan, if you can tell us a little.
IVF is intravitreal fertilization, and it's where they take the eggs from the woman and the sperm from the man, and they're put together in a petri dish in a lab, and the fertilization occurs. Then that embryo, usually on day 5, where it's called a blastocyst, is transferred back to the woman, back into the uterus.
Okay. All right.
And reasons why couples might be referred for IVF. One of the main reasons that I see is that women are told they have a low egg reserve. They're told this from an AMH. I've actually done a Facebook Live on low AMH, high FSH previously. And AMH, I want to get this message across, does absolutely not measure your egg reserve. It gives an indication of the follicle count at that time. That's all that it does. And in the vast majority of cases, 9 out of 10 cases I've seen, AMH levels will go up with herbs, food supplements, healthy, balanced living. And but the main other reason is that we're in an era in Western culture where we want immediate results. And so usually after trying for even as short as 12 months, and especially if the woman is over 35 and maybe a busy professional person, they're often referred to an IVF clinic, sometimes even if there's unexplained fertility, which is 30% of all fertility. And unfortunately, 75% of all these IVFs fail, and but that's the main reason. In my mind, the only reason couples should really be referred for IVF is if there's no fallopian tubes or severely blocked fallopian tubes, or very, very, very poor semen analysis. However, even in these circumstances, I've dealt with men with very, very poor semen analysis. Some testimonials are on the website that have been able to conceive naturally, and also it's either 5 or 6 women I've treated with completely blocked tubes that I was getting ready for IVF. I don't claim to unblock tubes, but while I was preparing them for IVF, did actually get pregnant naturally. That's over the course of the many years that I have been treating women. But they're the main reasons, Terry.
Okay. Okay. So Siobhan, so you treat women, men and women, who are either preparing for IVF or who want to maybe have had failed IVF and they want to conceive naturally.
Yeah. So both. So often couples come with failed IVF and they feel in absolute despair, and especially if they've had multiple failed IVFs and they feel they're a very complicated case. And sometimes I think they mightn't even believe me if I, really say, no, I think this isn't complicated. The big thing is finding out why the IVF didn't work, but to simplify it, I believe, would yet be specific. So the main two reasons IVF doesn't work is either a poor embryo, meaning the sperm and egg were weak, the combination, or maybe one was weak, or also implantation failure. Actually, the latest research shows 4 or more IVFs, 60% is immunological, which is also linked with clotting factors, which means the body attacks itself and can attack the embryo. And so they're the main. But the main reasons then also with implantation failure can be thick endometrial lining, thin endometrial lining, infection, and there's many different autoimmune problems. And so yes, that aspect, and also I'm trying to get a really good, strong embryo, preconceptual repair, trying to get the embryo as healthy as we can, whether the couple is trying naturally or whether we're hoping that the IVF is going to work and preparing the couple for IVF.
Okay. Okay, and just very briefly as well, I'm just wondering, in terms of the cases that you see for people who have had failed IVF, what kind of success rate do you have with them?
It is very, very successful. Actually, I was speaking to one lady, and just there this morning, I asked if I could share her story. She's a consultant surgeon, she's a Western doctor, so it's great she was open to try this. Andra Bohart, and she had 13 failed IVFs before she came to me about a year ago, maybe a year and a half ago. And she had 13 failed IVFs and 1 miscarriage. She's happy for me to share her story. She's into gardening, so I was trying to explain, as I do to many people, it's like, if there was a gardener trying to sow a seed, they would look at the soil, look at the environment, make sure it's right before putting the seed into that environment. Same with the embryo. We need to look at the environment that the embryo is being put into. So if there's any clots, in Chinese medicine they call this stagnation. We need to clear the stagnation so that the embryo can develop in a more nourished environment, and to nourish the babies, to help with implantation and to prevent miscarriage. Andra had 2 little boys. They're a few months ago, and they're doing great. And so thanks, Andra, for sharing that story. And also, there's many other testimonials on the website. Not everyone obviously writes their testimonial, but yes, it is very successful with the herbs and acupuncture and nutrition. Yeah.
So maybe we can ask Fiona now if you have a very interesting story, and actually I would say Fiona's story is probably very common. It's probably one that you hear all the time.
Yeah. And first I want to say thanks to Fiona. Fiona's come up from Cork. Fiona lives down in Cork, so thanks, heartfelt thanks to Fiona for sharing her story. She was coming to me today, and she said she'd share her story. So yeah, but it is a very common scenario that I see Fiona's story.
So Fiona, if you could maybe tell us a little bit about your fertility journey.
So I suppose myself and my husband started trying to conceive back in January of 2015. And like any couple, we were excited and hopeful and nervous at the time. But I suppose as the months rolled on, we were not successful, and that excitement kind of changes to frustration and then to concern that maybe something is wrong. So in September and October of 2015, we visited the GP, and we had kind of basic tests done, which involved blood tests for me and a semen analysis for my husband. The results of those came back normal, but at that point I was really quite concerned that something was amiss, so I actually asked to be referred on to a fertility clinic. So we first attended the fertility clinic in November of 2015, and the results of the kind of preliminary tests were not good. I had an antral follicle count of 6, which was considered very low for my age. I was 35 at the time, and they advised that I take an AMH test, which came back at 5.9, so again very low, and that confirmed a diagnosis of diminished ovarian reserve. So that was devastating to us at the time, because we weren't, we hadn't heard of it before, but any research that I did basically said, time is running out. Your chances, even with IVF, are much reduced with that diagnosis. The clinic advised that we go straight to IVF, that we don't try Clomid, IUI, any of the more conservative treatments. So that we needed to do that and quickly, that, to do it now, not in 6 months' time. So we did, and we started our first round of IVF in January of 2016. We weren't expecting a great response from me, given my diagnosis, but my response was actually far worse than what we had expected. So only one ovary responded, and in the end, only one egg was retrieved. So that was, again, another big blow to us in a short space of time, really. But that egg did fertilize, and the embryo looked good on day 3. So we made it to transfer, and we're hopeful that, maybe this was it. But unfortunately, that was not the case, and we tested negative after 2 weeks. So back to the clinic, and, looking for advice on the next step. So they said that they were disappointed in my response, that it was worse than the results had indicated. So we changed everything, different protocol, different medications. We went from long protocol to short protocol, up to the meds, changed the meds, everything was different. So we started our second round in July of 2015. Again, the response wasn't great, and this time we had another problem in that there was a big disparity between the growth of the follicles. So that cycle was actually cancelled before egg collection. And we opted to convert that cycle then to an IUI, but again, we're unsuccessful. So I suppose at this point we were, we spent a lot of time, a lot of money, we were getting really frustrated and just very sad, really, that that the outcomes were not happening for us. That we felt like we were putting everything into it, but we weren't getting the results. So we kind of decided at that point to give it kind of one last shot. So we went for a third round of IVF in November of 2016. Back to the long protocol, up the meds, few more changes with medications, and the response was much, much better. So this time 11 eggs were retrieved, which was fantastic, more than we had been told was even possible given my test results. So that was amazing. And out of that we had 6 embryos. 2 were transferred on day 3, none left. So the embryos all perished, and the 2 that we transferred were again unsuccessful. So that brought us to kind of Christmas of last year. We were very low at that point and very just done. We were done with it. We had lost a lot of faith in terms of what IVF could offer us, and we had been told really that was our only option, but there wasn't another treatment. There was nothing else that could be done. We were completely exhausted, financially exhausted, emotionally exhausted. We weren't able to do another cycle, and it wouldn't have been productive for us to do another cycle, considering we didn't really have any hope left in that. I had heard about Siobhan through friends of mine, not somebody I knew directly, but through a friend. And I knew that I'd looked at the testimonials, and I knew there were people in similar positions who had come here, but I really felt like she probably couldn't help me, because I'd been to the best doctors and I'd had all the treatments that were available and nothing had worked. Having said that, I wasn't ready to kind of move on to looking at third-party routes like adoption or egg donation just yet, and I couldn't do nothing. So we decided to give it a shot. So we came in January of this year, really with very little expectation, except hopefully to give ourselves a chance to kind of breathe and think things through and give ourselves a little bit of time, which we hadn't done in the previous year. So we did, and started on herbs and acupuncture, and it was like a breath of fresh air to me because I had been just so stressed, so exhausted, you know, trying to schedule appointments at 8 o'clock before work, and you know, working a busy job as well, and just trying to deal with the failures and move on to the next treatment. I'd had a really tough kind of couple of years, really. So this was virtually stress-free for me. It was it was very easy. I could come down on a Saturday, really just kind of we forgot what we were doing and just started kind of feeling better, eating better, looking after ourselves better, and just much happier, more relaxed. We had kind of taken IVF off the table at that point, so you know, I didn't have that kind of looming over me the next cycle. And basically I came to see Siobhan twice, and by the third time I had a positive pregnancy test, and I'm now 16 weeks pregnant. Yeah, so absolutely delighted. We're still pinching ourselves that this was actually happened, and so easily after everything we had been through. So yeah, thank you very much.
You're very good. Tell your story. I know it's actually difficult, but I think it's really helpful for other people to hear.
You can feel it in your
I
heart
know.
too.
I know.
Yeah.
Yeah. So I just say, actually, Siobhan, maybe, or even Fiona, maybe just tell us about like when you go into the IVF clinic, because a lot of people, if you go into the clinic, they don't know anything about the Eastern method, so they're not telling you about nutrition and stuff. Isn't that right? They're just saying that this is, you know, you need, as you said, you need the IVF now and things like that. So
Yes.
yeah.
There is, well, for me and with the results that I had, I was told there's nothing we can do to improve the quality of the only solution.
So Siobhan, tell us about how the traditional Chinese medicine views these things. Like you said the thing about the AMH, but you were saying it's all about the balance and things like that.
Yeah, in my mind, nature is on your side. Nature wants you to have this baby, and it's all about getting the balance right. The person, when you know yourselves when you're out of balance, we all do, emotional, physical, psychological, you know, and it's all about getting the system into balance. And if we're out of balance, this can encourage our blood to be thin, our blood to be clotty, or the environment not to be good for the egg to develop in. So it's still the same egg, but if that egg can be nourished in a well-nourished environment, the egg will definitely be better and the quality will definitely improve. And the same with the sperm. And so yes, so I just happened to mention to Terry earlier that I absolutely believe if a woman comes to me at whatever age, you know, at 40 even, and if her system is out of balance, and if she takes some herbs, good diet, some acupuncture, at the age of 41, she should be more fertile than she is at the age of 40. You know, and I've seen actually there's a woman, Kerry, who has written her testimonial, for instance. It's not up on the website yet. She came to me and she had a baby with her at the age of 42 that had Down syndrome, and she took herbs, got really healthy. Obviously, it was her choice, but I really felt if she got really healthy, you know, everything should be fine. And at the age of 43 last year, she had a really healthy baby, and so she's happy to share her story as well. The testimonial will be going up, but it just proves to me that sometimes women are told at the age of 35 their fertility goes down. I've seen the opposite, and it's all about the quality. That with Fiona's story, even with the third IVF, even though she got 11 eggs, for me it's like if you have a pot of really healthy stew, you can give it to 2 kids, or you can divide that between 11 kids, you know. So if you're dividing it between, so the same nourishment is in the system, but if that's divided between 11 eggs, or if it's just 2 or 3 eggs, 2 or 3 eggs are going to be better quality, you know, because you're given the essence is what they call it in Chinese medicine, the qing, and the essence to those particular eggs. And so then the quality will have to be better. And as I say, nature's on your own side. Animal breeders understand this. I don't know what I like to speak about animals, but animal breeders understand this, and people that know me know that I often compare people to animals. But there is definitely more research gone into bull sperm and stallion sperm than there is into human sperm. Whereas with animals, they'd be analysing exactly how much copper is in the soil, or how much manganese or minerals are in the mineral slab. If there were racehorses, they wouldn't be racing them around the field. It's like the farmer as well will go an hour and a half or 2 hours to the bull mart to get the best possible bull, because they'll understand it's not the average, and the male is 50% of this potential embryo, as we recognise it in Western culture. Same with the animals, but there'll be much more emphasis put on both sides with animals, and sometimes we can learn from that, learn from nature and from mammals, and I absolutely believe we can learn from that, from both the stress. The animals aren't put under stress, and they're fed a really good diet, whether they're planning natural conception with the animals or whether they're planning artificial insemination with the animals. It's the same protocol. Yeah.
And what the woman goes through as well when they have those IVF treatments, even just trying to produce extra eggs and things like that, surely that must be extra stress on the body. And that's probably that's part of what you were saying before about how the fertility is best natural. It's a natural process.
Yeah. It's everything is better as a natural process. Actually, the latest research shows it takes 375 days for follicular genesis. So that means it takes 375 days for the egg to develop in the follicle before it ruptures from the follicle. So usually the woman releases one egg every month. But say, for instance, if a couple had IVF next month in August, it brings fast forward the September egg, the October egg, the November egg, the December egg. So also we have to think about the child that comes from IVF and their fertility and how their health might be compromised because of this, and their kids. So yes, don't get me wrong, I think IVF is the best thing ever to give a couple a chance to have a baby that otherwise mightn't have that chance if there's absolutely specific cases where they need IVF. But if they don't, if they're not really in that category, I would strongly advise couples to try the natural route first. The research is out there. Babies born naturally are definitely healthier babies than babies born through IVF on the normal run of things. But as I mentioned previously, if a couple needs IVF, and so I absolutely support them nutritionally, get the environment right, and to support that child born from the IVF will be of better health, which I've seen, yes, with the babies, that couples I've helped, they have very healthy babies through the IVF. But sometimes in IVF clinics, that's not explained, that they're, even if they eat healthy or maybe take some food supplements or have more of a balance on the stress levels, and work with that will help as well, fertility, whether IVF or whether it's natural.
Yeah, I think it's really important to mention as well, like Fiona was talking about even sort of the financial and emotional costs that are associated with it, and that the IVF success rate is only about 15%. There's a lot to actually to think about there, between the costs and everything else. Fiona, maybe you tell us a little bit about your experience with your initial, when you first went to Siobhan.
So myself and my husband came here the first day together, told our story to Siobhan, who kind of had a look at our tongues and basically told us she didn't think that our situation was that complicated. She felt like this is not a big deal, we can sort it out. You need herbs, acupuncture, kind of went through, but Siobhan felt very confident from the first day. I didn't. This is quite nice of her to say that, but I doubt very much if this is all we need. But it was fine. I mean, there was nothing invasive or traumatic or difficult. We had been through a lot worse, a lot worse appointments than that one. But I suppose I just didn't buy it that it could be that easy. But it was easy.
Yeah, because also some people, you know, that mightn't be open to Chinese medicine, might think, oh yeah, it's one of these things that you believe in, maybe it'll work better, but that is certainly not the case. I'm sure you weren't one of those.
I wasn't a believer. I'm very much a science girl. So I didn't believe in it all the way through. I didn't believe in it. I just didn't find it that difficult to do, and I felt I had to do something. So
you had to do something more. I remember. That's interesting. Okay.
Also, actually, when we're talking about the IVF too, just with the man, it just came into my head. A lot of IVF clinics do ICSI, and ICSI means sperm selection, where they pick one sperm and inject it into the egg. But if a couple needs the IVF and if the sperm can be boosted more, if the problem they're going for IVF is because of poor semen analysis, it's usually done with either a poor sperm count or a poor morphology, which is the shape of the sperm. But research with ICSI, the babies can be weaker with ICSI because even though clinics can both boost to have big magnifying glasses and all that, which is the best sperm, the one with the biggest head, the one that swims in a straight line, the one that looks the biggest, the one that, you know, swims the quickest, nobody knows, nature knows. So if a couple can avoid ICSI but still needs IVF, if we can boost the sperm up and then, you know, so the sperm can be still put in a petri dish and let nature take its course and let the strongest sperm make it to the egg. Or if they absolutely need ICSI, that the pool of sperm that they're pulling from is more nutrient enriched, that just more oxygen after getting to that sperm with the herbs and supplements that I've used. So the pool that the embryologist is pulling from to inject into the egg, that is of much better quality and much more nutrient enriched. All right, I came into my head to talk about that.
Okay, so if you have questions, if you want to go ahead and put them in, we're sort of coming to the end of this now. So if you do have questions, go ahead and put them in there. And I just maybe ask Siobhan again, just in terms of those couples who are looking to maybe conceive, what are some of the things that they can do themselves to improve their chances?
Right. Well, one of the big things is to get your system into balance. As Terry knows, it took me a long time to pick the logo for this place where I am here, this therapy place where I am here, and I get a lot of my answers from my writing. And when I was writing one day, I said, "What is wellness? Wellness is balance." And I thought that is it. If you know, with me treating fertility, I aim to look where the system is out of balance and then get the system back into balance. And so that's emotional, it's physical, psychological, spiritual, you know, where we're out of balance and trying to get the system back into balance. So in very basic terms, if the person is overweight, maybe lose weight. If the person is underweight, put on a little bit of weight. If the person is stressed, work on methods to improve their stress. There's very good apps out there called Headspace or Calm.com, and even walking in nature, even just taking time out for themselves, laugh more, feel more relaxed, and also they will know themselves if they're out of balance. And my thing is yet to be, even though my whole thing is simplified, as I say, yet to be specific. So if they know there's an autoimmune problem, trying to treat that autoimmune problem. If they know there's a clotting factor, trying to treat that clotting factor. Obviously, I'm not against Western medicine at all, But if we can do it naturally, try the natural route first. That's my aim. Or sometimes, it's used in a combination. I'm actively a registered midwife, as you know, and so I look at the person's results, and I've done different courses, and I've just done the diploma course in obs and gynae with he's a consultant medical doctor last year, so I've learned a lot from that also, and on how to combine, Western and Chinese treatments to get the person back into balance. Yeah.
Okay. Okay. So there's a comment here. I'm just going to read it. It's not a question, but it's a really lovely comment from Valerie Redmond. And she says, Siobhan is amazing, so well informed, so highly trained, and so dedicated to this area. She is kind, professional, and very generous with her information. I never had IVF, but I did have several miscarriages, and now I have 3 very healthy, beautiful children. Thanks to Siobhan's incredible help. Thank you, Siobhan. So that's really lovely to come in.
Valerie. Valerie's a very good therapist herself. Valerie's a physiotherapist here in Wexford.
Okay.
No, Valerie's a very good therapist. Valerie, thank you. Thank you for sharing that. Appreciate it.
So I don't know, did you guys want to add anything else? Or,
I just want to say a big
thank you. Yeah, absolutely.
Thank you to Fiona, because it is a big thing,
It is.
On telling your story, such a
Absolutely.
personal story,
Yeah.
and I really hope Valerie's story will give hope to other people.
Yes.
And Valerie is down in Cork, and sometimes people think, oh, I'm such a distance, or, Wexford is too far away. I do treat people from all over, Mayo, Belfast, even England, I have a couple of people coming. So I usually only need to see people once every couple of months, but it's much better to see the couple, even if the woman or the man thinks, no, the problem is with me, because the other side of the couple is still 50% of that potential embryo.
Yeah.
I might only need to see them once, but just to recommend a supplement or maybe 2, just to help to boost the other side a little bit, even that can make the difference. Yeah.
Okay, thank you for joining us. Siobhan has been doing Facebook Live events to help couples with fertility, to give information and also to give hope. She's really big about giving hope to people, which is like so incredible. If you want to get more information, you can get that at www.fertilitytreatment.ie, and you can find her at the new Sonus Health and Wellness Center in Enniscorthy. So I would suggest, if anyone is having issues in the area of fertility, you might look at giving her a call sooner rather than later, primarily because Siobhan is actually very, very busy, and just to even get yourself on the list, she's booked up weeks in advance, but she is so keen to help people, and she has helped many, many people. So do give her a call and see if she can help you, and you can reach her at 053-927-0725. And thank you very much for joining again.
Just to say, that I really hope I can help. If there's someone out there that feels, oh no, my case is much too complicated, please do think about coming in to me even once. And I am very straight talking. I won't give you false hope. If I think I genuinely can't help you, I will absolutely tell you that.
Yeah.
And but if I can help, as I say, even if you're planning an IVF, just so many IVFs fail. Actually, the World Health Organization statistic is 1.5 million people have IVF treatments, 1.2 million fail every year, and so it's about, even if you're out there and you think, oh no, I have to have the IVF, think about coming even once, and I help you to get started on getting your system into balance and get everything up to optimum health, to get you ready for the IVF.
I think that's really important, because people have come to see Siobhan even in preparation for IVF, and they have actually gotten pregnant naturally before they even went to the IVF clinic.
That has happened many times.
Yeah, definitely get in touch.
Yeah.
Okay, thank you again. Thanks so much.
Also, actually, sorry, just to mention one thing. Also, if a couple is having donor egg, also obviously I can help them prepare or donor sperm, for that also. Yeah.
Okay.
Okay. Thanks.
Okay.
Thanks
If
for
you
listening. Yeah.
if you have questions even after this, you can always email them in or put them in the comments, and we'll get back to you. Okay. Thanks so much. Take care.
Thank you.
Bye.